Right now, we are joined by Ben Donahoo of Donahoo Physical Therapy in Sylacauga. Ben, good morning to you, sir.
Good morning. Nice to be here.
Good to have you with us this morning. And those of you who do not know, the physical therapy store is on West Fort Williams here in Sylacauga. Ben, tell us a little bit about yourself and how you got to this point.
Well, I'm originally from Childersburg, married to my wife, Jennifer Donahoo, 3 kids, all grew up in this area. Got into physical therapy, worked for the hospital here for a few years. Wanted to venture out and give people a little more personal experience. And that brought us to Donahoo Physical Therapy that's there on Fort William Street.
Now, did you start this company?
I did. I started this company in 2014. We've been there for 3 years. We just keep growing every year. Just hired a new therapist on staff about a year ago. And so we just continue to grow and helping the people in the greater Talladega County. Physical
therapy covers a lot of territory, and we're going to talk about that this morning. Who do you treat?
We treat everybody from 6 months to 106. Anybody with a movement disorder, and basically that's what physical therapy is. If you have trouble moving, then we have something there for you. So we can, if you have trouble getting out of bed, if you have trouble getting to the restroom, if you have trouble getting to church on Sunday, anything where you have trouble with a movement or a function, then we're there to help you, and we can help you get stronger and have more movement and a better quality of life.
Does a doctor have to send the patient to you, or how does that work?
You do, to go through your insurance. You do have to have it, and we take all insurances, and you do have to have a doctor's referral. Any doctor can give you that referral. You can come in for a free consultation, and you can call and set up an appointment without a doctor's referral, and we can have a consult. You come in, you say, hey, I'm having trouble with this and that. We will evaluate you, kind of take a look and say, hey, yeah, we can help this. And then you'll take that information back to your doctor, and he can say, yeah, this will work, or no, this wouldn't be for you.
What is the most common age group and most common ailment that you deal with?
The most common ailment's back pain. Everybody out there watching, and you and myself and everybody in your family that you know has had back pain at some point. And it may have been for an hour, it may have been for a week, and you may have back pain that's ongoing for a lifetime. But everybody's had some sort of back pain, and that's our major thing that we treat is back pain.
And is it an older generation, or does it matter?
It runs the gamut. We see football players, basketball players, teenagers, all the way to senior citizens with back pain from too much sitting. So we got to get up, get moving, and we're there to help you and motivate you to get moving.
I was in there the other day talking with Ben, and one of my friends, been a long-time friend, and he had broken both his feet, broken both his ankles, and I think he'd had surgery, and he was in there doing rehab. You do a lot of that.
That's right. It does, broken bones, pain, dysfunction, stroke rehab, anything out there that you're having trouble doing, what you enjoy doing, or even just necessities of daily living, that we can help you with that.
Have you seen physical therapy where maybe one thought that, hey, I'm going to have surgery? Have you seen physical therapy make such a marked improvement that they don't do surgery?
That is, every day we get a patient in that says, oh, I got a rotator cuff, my doctor says I need surgery, and he wanted me to try therapy first. Or I've got a meniscus tear and my doctor wants me to try, or I've got back pain and they said surgery's my option, but I wanted to try therapy. And we get those people back and they're just amazed that a few stretches, exercises, positioning, posture training, and then that pain goes away and they don't need those surgeries. So yeah, we see that, and we can't help everybody. Some people are too far gone and they do have to have surgery. But we eliminate a lot of surgeries, and 2 or 3 this week that I know of. The patients leave with a smile on their face saying, wow, I didn't have to have surgery.
Ben Donahoo, our guest this morning at Donahoo Physical Therapy on West Fort Williams in Sylacauga. I know you treat athletes and you treat older people, whether we're large or not so large. A lot of people like me that carry extra weight, they're more susceptible to aches and pains.
Well, gravity does have a way to do that to us. We can have aches and pains, but it doesn't really matter. Everybody's your own unique individual, and that's why you come in to see a therapist that's trained in the body, muscles, bones, joints, and we tailor that program to you. It's not, Jimmy Dale's program is not Ben's program, it's not, John Doe's program. Everybody, women's bodies are different from men's, and there's a whole gamut of different body shapes and types within those two. And so your program will be tailored to your pain, your specific joint, and your body type.
Insurance is accepted?
All insurances are accepted. We take people that don't have insurance. That's one of the main reasons I'm where I am today. So I can offer that service. If you don't have insurance, we will work with you.
I'm sure with people, maybe some of them a lot like me, we're impatient. Man, we want this fixed and we want it fixed now. I guess you guys have to have a lot of patience.
That's right, it is. And everybody, and like you said, today is what they call the microwave generation. We want it now. We want that meal in 30 seconds. And so everybody wants to be better yesterday, and nobody likes to hurt. But once you get in and you get that program and you get started and you see those results, then hey, this is working, and you're better off to keep going and keep doing and progressing your exercise program when you see results. And that's what we're about. If you're seeing results and you're getting better, then you're going to follow your plan that we've put in store for you. If you're not seeing results, then maybe we have to send you back to your doctor or a surgeon. But we're there to guide you in that endeavor.
Physical therapy treatments have evolved over the years, and there's always new treatments available. What are some of those that you offer now?
We've got a new treatment that's been out probably 3-4 years called dry needling, where we insert a monofilament needle. It doesn't have any medications in it. It's very thin, maybe the size of a hair. We put that needle right directly into the muscle, a trigger point, you would call it, and it releases that muscle so that you can relieve some of those muscle tension headaches, low back muscle spasms, calf strains and hamstring strains, and athletes can recover weeks faster with this treatment that we've seen. And that's the newest thing we've got out there. We also have a new cold compression unit that actually adds compression and cold at the same time for ice and compression to relieve swelling. So athletes that have ankle sprains, shoulder injuries, knee pain, that you get that swollen knee. Well, this cold compress goes in there and it pumps that swelling out along with the ice to help you recover faster.
The older we get, the more aches and pains one might have to deal with, and one would be in our knees. I know I had surgery on a knee years and years ago when I was playing ball. And it can become an arthritic knee. It can become, it just sometimes just pains you to get up and walk on it.
That's right. And people deal with that every day, and that's what we're there for. If you have that aching knee or that pain, you get up out of bed in the morning, or you're working out in the yard and it's nagging, you need to get it looked at. Call us. Come by. Say, well, you've been in our clinic. When you come in, you see me. Or you see Dan, or you see Abby, and we're going to be there when you open up the door. I say, hey, Jimmy, how you doing? And I'll be with you in a minute, and we'll get you worked out, and we'll, look at that need, look at that problem, so that you can be proactive in making yourself better, whether that's, preparing yourself for surgery or avoiding it.
I know one of the things that you guys excel in is making sure that patient is comfortable when they come in the door, and they're not sitting on their butt for 2 or 3 hours before y'all see them.
That's right. When you walk in our place, you sign in, check in with the secretary there at the front, and you get to work. The only day that you'll probably wait is the day you come in for your evaluation consultation. You'll fill out a little bit of paperwork, and then after that, you've got a plan after that first day. You know how to work that plan, and when you sign in, you'll come back and get to work. And I don't like waiting. When I go to the doctor's office, or I go to purchase a car or anything else, and so I feel like the people that come in don't want to wait either. Their time's valuable. If you got to be somewhere 1, 2, 3 days a week, as some people in therapy have to be there 3 days a week, that's hard to get somewhere 3 days a week. For an hour of your time, and people are busy, and so we take that into consideration.
All right, Ben Donahoo, Donahoo Physical Therapy, our guest in Sylacauga. Now, if they need more information about physical therapy or about the company, you got a webpage?
We're on Facebook.
Okay.
We do not have a website per se, but we are on Facebook. We're on Twitter at Donahoo Physical Therapy, Instagram. You can contact us on Facebook. We're there at Donahoo Physical Therapy. You can call us 487-8040 or just stop by.
Are you open every day in the week?
Monday through Friday, 8 to 5. We're there, open during lunch hours. We'll have somebody there if you need to run by during lunch, ask questions, get paperwork, and we're there to help you get moving.
All right. Thanks, Ben, for being with us this morning.
Thanks for having me, Jim.
Donahoo Physical Therapy is our high school football game sponsor of the week. Our corporate sponsor will be over at Legion Stadium this weekend for Sylacauga and Cleveland County as we wind down the regular season. Donahoo Physical Therapy will be our corporate sponsor for that, and we appreciate you doing that too.
We're glad to do it.
We got more Daybreak just ahead. Don't go away.